If you've been doing posture therapy for really any amount of time, you're almost certainly familiar with a stretch called hip crossover. It looks a little bit like this. And this is a great stretch for increasing your ability to maintain pelvic stability under the stress of lumbar spine rotation. I'm going to tell you why, as a posture therapist, I almost never use this exercise anymore, even though it's one of the best posture therapy exercises out there. That sounds like something you're going to be interested in. Stick around. My name is Posture Monster John. I'm the only psychedelic posture therapist in the known universe. I'm the author of Psychedelics, Chronic Pain, and the Posturedelic Hypothesis, coming out June 4th. And this is a video about one of the exercises I mentioned in the book called hip crossover, which I've actually never covered on my channel before, strangely enough. But I'm going to be showing you how to modify it with this strap. This is part 3 of the posture therapy revolution. If you're not familiar with parts 1 and 2, well, you can check the description down below for a playlist called Posture Therapy Revolution, where I'm describing about how you can use this simple, inexpensive strap to modify the vast majority of posture therapy exercises. Let's dive into it with hip crossover. Now, the standard hip crossover exercise is actually one of the exercises that a lot of people do wrong. So before we get to modifying it with the strap, let's make sure we're clear on how to do hip crossover, just in case you don't have one of these straps with you right now. Hip crossover is going to start by getting yourself into what is called the hook line position. You want to make sure you have enough room so that you can have both your arms all the way out at your sides like this. Now, from here, I'm going to lift up one leg and place the bony part of my ankle directly on top of my knee, or my opposite knee. And from here, I'm going to make sure that I am pressing with this knee, I'm using my hip to move this knee away from my body towards the opposite wall, which is going to place a stabilizing force on my hips and pelvis. From here, I'm going to make sure that I have my palms facing down. I'm going to press into the ground with my thumb and forefinger just a bit. While I'm pressing away with my hip to move that knee away from my body, I will then begin dipping down this knee until my foot gets flat on the ground. Now, here is where most people do this exercise wrong, is they let the lower leg go kind of flaccid and floppy here. And instead of maintaining this position between the ankle and the knee, as I have it here, they let that knee go slack and it drops to the ground. It's a subtle change, but is a huge difference in how your musculature is maintaining proper position in this exercise. The final thing I need to do is make sure that I move my neck to whatever degree is comfortable in the opposite degree of rotation, drops the opposite direction of rotation as compared to my lower body. So this is the final position of the hip crossover exercise. Again, let's cover everything, all the important parts. I'm making sure that I am pressing away from my body with this left knee. With that, if I'm not doing that properly, it'll look like this. So I want to make sure I'm pressing away from the body. I want to make sure that I have a rigid position of my lower knee and ankle here. I'm not just letting it flop towards the ground. I'm using my inner thigh muscles to keep that knee suspended and locked in place against the ankle, pressing away with the opposite knee, rotating with the head, pressing into the ground with my thumb and forefingers, and that is the proper position for the hip crossover exercise. In order to come out of this exercise, I would first unrotate my head back to a neutral position. Then I would rotate my entire lower body back to a neutral position. Then I would take this foot and place it on the ground. And I would, of course, always repeat on the opposite side to maintain a neutral rotation stress on my body as I'm going throughout my routine. I want to make sure I treat each side of the body the same. So I'd want to spend some time on this side as well, making sure I press those thumb and forefingers, rotate the neck, don't let the knee go to the ground, and push the knee away from the body. All those things at the same time. And then I can come out of it just like that. So, standard hip crossover. that's a great exercise. And if I don't have this strap, I'll use hip crossover. But if I have this strap, I never use standard hip crossover. I love this modification. So let's briefly talk about how we're going to get into this. I'm going to talk about this very briefly. If you want to see this process of getting the strap getting into position with the strap more in depth, look at chapters or parts 1 and 2 of the Posture Therapy Revolution playlist. So as you can see, all I did was go around, through, put the leads onto my feet. This is where this exercise gets really interesting because look what happens when I put this strap in the proper place, cinched up around my upper thighs here. I cannot straighten my legs. You see how the strap prevents me from getting more than a 90-degree bend in my knee here? That's what we want. I want to have my knees fixed at this 90 degree because of the tension in the strap. And what this allows me to do is get into the hip crossover position in a little bit different way. Now I am getting my this leg positioned such that I I've gone a little bit up above my ankle. If you see, it's not the bony part of my ankle anymore. It's now a little bit higher for me, and I'm pressing out against the strap in each direction. And I now want to bring this foot down to the ground. Let's get a little bit better angle here. I'm going to bring this foot down to the ground. And now look where this foot is. This foot is way up in the air. In the other exercise, this foot was allowed to come down here. Now I can actually keep this, I can work on, I can actually add a static or a dynamic component to this exercise. And while I'm pressing away from the body with this hip and pressing against the strap as hard as I can introduce a femur rotational component to this exercise right here, and it feels amazing. And I'm also having to really be more active with my lower body to keep tension on the strap. And becomes a much more of a strengthening exercise than even a stretch. And I'm stretching while I'm strengthening at the same time. And I would come out of this by doing this type of opposite movement, just like in the standard hip crossover. And let's see what that looks like from the other side. So I've got my hips. I need to reset the strap here a bit. I've got tension on, I'm trying to straighten each leg. I can't straighten each leg, but I'm trying to. I take the foot all the way down to the ground to where, well, if you have that much rotation. And then I, and I can even introduce that femur rotation in this position here. Once again, oh, this is a strenuous exercise, believe it. Maybe she's got bad audio there. This is a strenuous exercise, believe it or not. This is quite difficult to maintain and keep tension on the strap in all the places I need to. But this is an exercise unlike anything you've ever done before. I can guarantee that. Oh my goodness. I can come out of it just like that. Whew. So that is how you can modify hip crossover with this multi-loop strap. You can find a link to one of these straps in the description down below. And additionally, you can find more information about my book, Psychedelics, Chronic Pain, and the Posturedelic Hypothesis. You can find a playlist to previous parts of the Posture Therapy Revolution, including this strap and information about the other part of the Posture Therapy Revolution, which is introducing psychedelics. So we've got two components of how things are changing in the realm of posture therapy right now. I hope that you subscribe and follow along so you can stay up to date as it all happens.